Okay, good evening, everybody. So glad you could join in tonight for the 2023 PA information session. My name is Virginia Hughes. I am the Director for Medical Diagnostics Pre-PA in the College of Health Sciences. Tonight we will cover these topics. This session will be recorded and uploaded to my YouTube channel. So we'll start out with a definition of what a PA is. That may be a question you'll get on a interview if you are selected for an interview. The PA title, there has been a change that happened in 2021. CASPA, patient contact hours and shadowing, the personal statement, GRE, the PA-CAT, interviews, assured admission. We have an articulation agreement with Arcadia University, and then some Q&A. So let's get started. So a physician assistant or physician associate are licensed clinicians who practice medicine in every specialty and setting, variety of healthcare settings. They can take medical histories, conduct physical exams, diagnose and treat illnesses, order and interpret tests, develop treatment plans, prescribe medications, perform procedures, and assist in surgery. They abide by the laws of the states, working under supervision of a physician. So what happened in 2021, the organization, the American Academy for now what's called the Physician Associates House of Delegates passed a resolution affirming the physician associate as the official title of the PA profession. So does that mean that on May 25th, 2021, every PA that has been certified can now call themselves a physician associate? No. And the AAPA, which is the governing body, has recommended that they must abide by the state laws. And I'll give you an example. Not every state has amended their legislation concerning PAs, changing the name from physician assistant to physician associate. For example, a resolution, a Senate resolution in the Delaware legislature was signed by Governor Carney to put the state of Delaware into the mix of what's called a compact, where if you are recognized as a compact state in the realm of PA lingo, you can go to one of those other compact states and have privileges to practice. And what term did they use in drafting that resolution? They're still using physician assistant. So, to answer that question, some of you may be wondering about that. It all depends on the state laws, whether they have state laws in the institution, the healthcare facility you are working at, whether which term you use. So what is CASPA? You may have heard of CASPA. CASPA stands for the Central Application Service for PAs. There's the website there if you want to go and navigate the site. It is a service of the PAEA, which is the Physician Assistant Education Association. Now there are a total of 303 accredited PA programs nationwide. And what CASPA does is to streamline that process, streamline the application process by allowing applicants to apply to multiple programs with just one application. But there is a caveat to that. About 95% of the 303 accredited PA programs are members of CASPA. So you have a few that are not. For example, SUNY Downstates, University of Charleston. And so what do you do in that case? You would go to their respective websites and follow their instructions for applying to their PA program. So that answers that question. Can you apply to any PA program through CASPA? No, only the ones that are members of CASPA. So once you have an account on the CASPA portal, you can proceed to identify the PA programs you want to apply to. On average, that's about 7. You can document your patient contact hours, shadowing, healthcare experience, volunteering, non-healthcare employment, any research you may have done, teaching experiences, and extracurricular activities. So there's a drop-down box, and you would just select the category that applies to you. Certainly more than one may apply. And you would just go and continue to fill out that form, which consists of listing your supervisor's information, how many hours per week you worked, and CASPA will calculate the total hours based upon what you input. There's also a radio button that asks, can we contact? Do you give a waiver for us to contact that person, that facility? And then you can add your academic information, licenses and certifications, and the evaluator information. So what does the evaluator mean? So that's the person you ask to write a letter of recommendation on your behalf. CASPA uses the term evaluator for that. You need a minimum of 3 and a maximum of 5. So you can ask a total of 5 people to write a letter on your behalf. So these evaluators can be a PA, preferably, medical doctor, professor, supervisor. They will submit their letter themselves. They'll receive a email from CASPA letting them know which applicant has asked them for a letter and the due date. So the professor, the PA, the MD, the supervisor uploads the letter. The applicant does not. In addition to submitting or uploading the letter of recommendation, evaluators will also complete a survey where they will rate the applicant on the following: adaptability, conflict resolution, empathy, intellectual ability, interpersonal relations, oral communication, reaction to criticism, reliability, self-awareness, team skills, and written communication. Now, there is an option for NA or not applicable, aside from the 1 to 10 or 0 to 10 scale. So the people that you ask, you want to be cognizant of that, because, you don't want to have someone write a letter on your behalf that is inputting NAs down the line, or for the most of these. You want to identify someone that can, in effect, rate you on these attributes. And if you can, I think that will, greatly boost your application. Academic history. You need to report all courses on your transcript, and CASPA does not recognize any type of grade forgiveness. Department prefixes and course numbers must precisely match those on your transcript. So not only are you going to input, all this information manually, all the courses, but CASPA is going to check what you input against the official transcripts they receive from the schools you've attended. Enter courses under the institution where you originally took the course. List any study abroad courses you took, and any advanced placement courses. Also, they're asking you to provide information on the high school you graduated from. You don't need a transcript from your high school, but you do need to enter which high school you graduated from and received a diploma. So how do you send transcripts? You can electronically send them using the studentclearinghouse.org website, and the University of Delaware does align to this organization as a vendor. You can also mail them to that address there, but they need to be mailed directly from the registrar. You can't mail them yourself. They have to be original. They can't be photocopies, and transcripts cannot be emailed. Now, CASPA will compute both a science GPA and a non-science GPA. And there's the very long URL link to let you know how that is done and which courses will ascribe to being science or non-science. Certainly the humanities would be non-science courses like hematology, medical micro would be science courses. But here's an example of forms that they compute the year of the students, how many credits they completed, the quality points. So for each A through F letter grade, CASPA will assign a numeric number and then multiply that by the number of credits for that course to arrive at the quality points, and then that will lead to generation of a GPA. And you can see here that it's not just your undergraduate, that any post-baccalaureate graduate courses are all at play. And here's an example of the form they complete for science and non-science categories. So there are a few PA programs that are asking for supplemental information. So once you submit your CASPA application and pay the fees, the application gets verified. For example, might receive a message, thanks for submitting your application on CASPA. We have all the information we need. Your application is complete and in for review. Or we require a supplemental application and an additional fee in order to process your application and mark it as being completed. For example, you may receive the question, how do you think having many of your clinical rotations at, say, ABC Medical Center will benefit you in your clinical practice once you are PA? Or, from your experiences, what makes you stand out from most other candidates, as well as makes you a strong addition to our PA class? And they may ask you to provide an additional essay, even 2 additional essays, an autobiographical essay, and also a stressful experience essay, where you essentially articulate something you went through that was deemed to be stressful and how you handled that. So be aware you may get some of these supplemental questions predicated on the PA programs that you apply to. Some programs also will ask for this CASPA test. This is described as a situational judgment test, where the applicant will respond to a set number of questions within a certain time frame, a small number of questions, and then the scores are submitted directly to the PA program that you or programs you apply to. CASPA, you can also have standardized test scores sent to CASPA, for example, the GRE. Now, not every PA program requires the GRE. Thomas Jefferson does not require GRE. But even if one of the PA programs that you apply to requires the GRE, you must take it. PA programs that require the GRE have a unique GRE code visible on the CASPA website. So PA programs can only see the scores that are sent with their respective code. Official GRE scores cannot be removed from your application. They will carry over from cycle to cycle, and GRE scores can be received by CASPA at any point during the application cycle. Now, the CASPA website does close for 2 weeks in April, where nothing can be uploaded. But regarding the application cycle, GRE scores can be uploaded at any time. What are the fees? They've just been raised. They were $179 for the first designated PA program, so now they're $184. And then for each additional program, let's say you're applying to 7 programs, for each additional one after that first one, they'll charge you $61 for each additional program. Now, the fee waivers are available. And there is the link. There is the link if you'd like to know more information about their fee waivers. Okay, so what have MDD pre-PA students participated in, engaged in accruing the patient contact hours? And first I'll say that a good target, how many hours do you need? I would say between 500 and 1,000 to render your application competitive. Our students have gone through EMT training. That's a very popular way. And it's wonderful because you get to see so many different things, so many different types of injuries and conditions that you can talk about in your personal statement, and if you are granted a interview. And I also want to say that not all PA programs conduct interviews. A lot of them will have town halls or career days to go and talk to faculty and administration. CNA is another popular route. Patient care tech, working in a physical therapy clinic, helping patrons or patients through their treatment modality, phlebotomy, drawing blood from folks, and medical assisting. And some of our students have actually gone on the website Indeed.com and looked for medical assisting jobs. The training can be costly. I think Del Tech offers a program for medical assisting. They offer a program for phlebotomy. But some of our students have been able to get their foot in the door without completing any training if that employer does not require it. If you can, I'm in a medical diagnostics program. I'm learning about all these things that are very helpful, could be helpful for this position. And some of our students have done that, earned patient contact hours without having gone through a formal training program for medical assisting. But you want to choose something you enjoy. The culture in a firehouse is different from the culture in urgent care, or the culture in a hospital in the ER. So you want to choose something, an environment that you will thrive in. Shadowing. Not every PA program requires shadowing. Certainly, any type of shadowing could boost your application. How to identify a PA to shadow? Well, many students have taken positions and been trained as a medical scribe, and in that position, you come in contact with PAs, with MDs, and perhaps you could get close enough to say, could I shadow you, for a day or two. Some students have been fortuitous in asking a friend of the family who's a PA or an MD to shadow them. There are websites you can go to. Health Grades, for example, can give some contact information in the city in which you live. You could reach out to see if they'd be willing to have you shadow them. Now we have a forum on our MDD pre-PA website that greatly mimics the one you see on the CASPA website, drop-down boxes and all, where you can, it's a PDF form, so you can just fill in all the pertinent information for your working as an EMT or a CNA, the number of hours, your supervisor information, and you can file that. You can print them out, or you can electronically file them. So when the time comes to complete that step on your CASPA application, you will have them. So we have a form there for you. The personal statement. Just some tips. You want to keep it positive. You want it to be perceived by the PA admissions committee as authentic, as genuine. I think that's one of the most important attributes of a personal statement. You don't want to dwell on things that cause you not to get A or a B in a course. You can present it as I overcame this by doing A, B, and C. That would be a good way to navigate through a difficult situation that you overcame, and that would be viewed as a positive by the PA admission committee. Don't use the term physician's assistants or physician's associate. That would be I think people have called this a personal statements killer. The name of the profession is physician assistant or physician associate. So be sure not to use that apostrophe X, that would be wrong. Articulate an experience you had with a patient you took care of, how it impacted your life, reinforced the decision to pursue PA studies, how it caused you to reinforce your passion for serving others. Study abroad experiences. I went on a MedLife study abroad trip with 3 other MDD pre-PA students in May to Lima, Peru. And I'll tell you, never experienced anything like it. We went to impoverished municipalities in Lima, Peru, and we set up tents at a central meeting place, like a place where they play ball. And the people came, and some of them, walked for miles to get there. It was an incredible experience, and that would be an excellent way, something to articulate in your personal statement, how it impacted you. If you're an EMT or a CNA and you were fortunate enough to participate in the MedLife experience, how did that experience, did it change you once you got back to the States in your position as an EMT? You could talk about that. Atlantis is another great company in which students shadow physicians in different countries. Can also inject that in your personal statement. The tone of your writing, your tone, as I say, should come across as being extremely authentic and genuine. I think that's one of the most important things. Read over your statement multiple times, have others read it. Make sure there aren't any, things that may be perceived as a bit on the negative side. Check for grammar. Grammarly is wonderful. That service that will point out any grammar mistakes automatically, and make it unforgettable for all the right reasons. You don't want it to be, unforgettable for, not the best, but make it unforgettable because these PA admission committees, they are siphoning through thousands of personal statements in some cases. So you want to, just be sure everything is right, because I really think the personal statement is right up there with the GPA and patient, the activity you've chosen for patient contact experiences. So one of our graduates allowed me to share her winning personal statements in these PA info sessions. She's a PA now. She's certified, working in New Jersey. So this is how she started out. You probably just ate too much pizza. That grabs you right away. You want an attention grabber right away. The nurse casually said into the phone to her husband, who was at home complaining of abdominal pain. I had recently started my job as a medical scribe in the emergency department, and on this shift, I was working with Dave, a physician assistant, not a physician's assistant. There's no apostrophe S there, just to reinforce that point. A physician assistant. You can also use PA. The nurse continued her conversation. So the pain is in your right upper side. Are you nauseous? When Dave heard this, he asked the nurse if he could speak with her husband. After gathering more information, Dave suggested he come to the ED emergency department immediately. Upon his arrival, several labs were ordered, as well as imaging. Within a few hours, the patient was notified that he would need a cholecystectomy. After the diagnosis was made, the nurse was so grateful, she hugged Dave and me. I reflect on this memory when I am overtired from balancing my clinical hours, tough coursework, and other commitments, and it helps to reinforce my decision to seek a career in medicine. The path to this decision has been relatively straightforward. From an early age, I had an aptitude for math and science. My father is a chemist, and he always encouraged discussion on why and how things happen. These conversations made me inquisitive, curious child. Taking biology in high school reinforced my interest and confirmed that my future journey would involve life sciences. I am fascinated by the uniqueness of living things, especially the human body. We all have the same general makeup, yet each person's body operates and responds to treatment differently. This is why the practice of medicine interests me. Every day there's a new patient offering a different challenge that requires a holistic way of thinking to diagnose the problem and to pursue a remedy. Because I found this so intriguing, I decided to explore career opportunities in the medical field and at the University of Delaware. At the start of my sophomore year, I began shadowing to gain exposure and to learn the variety of options to become a physician assistant. Shadowing and surgery allowed me to appreciate, understand the daily responsibilities of a PA. I learned that after assisting with a procedure, the PA orders medication, checks in with the patient. In particular, one thing that caught my interest is that PAs have a significant amount of face time with patients. They are able to put the patient's mind at ease and explain everything the patient needs to know about post-op care. The PA demonstrates compassion and empathy, which notably improves each patient's experience. One PA I shadowed told me, the patients really love how much you take an interest in them. This reminds me to always be fully engaged when I'm with the patient. After my experience shadowing, I started volunteering for different service organizations. A specific organization, Laura's Hands, impacted my life quickly in college. As a volunteer, I helped my clients with everyday needs around their home. My clients, Pat and David, have become incredibly inspirational to me. Not being able to walk on my own, make a meal on my own, or clean up on my own is never something I need to worry about in my daily life. David struggles with these tasks every single day. Early on, I found that offering help came naturally to me, and the conversations we had formed trust and enabled favorable outcomes. Being able to better understand their emotional and physical needs improved our relationship and my work as a volunteer. As a PA, I hope to apply this aspect to my personality to produce more effective patient interactions. By my junior year of college, I began working as a medical scribe. This was an excellent opportunity to work directly with providers and to gain further healthcare experience. Working in an emergency department was not easy, and it took some time to adapt to the fast-paced environment, but I was committed to learning. In the end, I found that all the techniques I developed over the years to successfully manage my busy life and to work as a team prepared me well. I thrived in a pressure-packed workplace where scribes, nurses, PAs, and doctors each had a vital role in the patient's overall experience. I was responsible for recording information, including medical history, physical exam findings, and results for each patient that the provider encountered. In addition, being able to work with PAs at least once a week was beneficial to my growth as a student and as a future provider. Their intelligence, kindness, and willingness to educate others are reasons that have solidified why I want to pursue this career. I can't imagine myself being anything but a PA. It seems that I've been preparing my whole life for this, and since I've made this decision, I have been focused on my mission. I know I'm on the right path, and I am excited for the opportunities ahead. I want to make a difference with all my patients, the way PA Dave did for that nurse's husband. I am capable and confident in my ability to become a successful PA. Note that the student applicant referred back to her introductory experience in the final paragraph, which is a very nice, tough touch and is very effective. Note that the statement reflected a timeline from childhood, injecting sophomore year, junior year. The essay had a consistent positive tone, listing all related experiences which influenced the applicant's decision in becoming a PA, which she now is. Also note how confident the applicant presents themselves. Not all programs require the GRE, and there's another test, the Physician Assistant College Admission Test, that has been active probably for about 3 years. It's different from the GRE. It consists of 240 multiple choice questions, and the subjects reflecting those questions include A&P, biochemistry, general biology, general chemistry, organic chem, microbiology, behavioral sciences, genetics, and stats. Both the GRE and the PACAT do have a time limit, 4.5 hours for the PACAT, 3 hours, 45 minutes for the GRE, and you can see the cost there as well. The PACAT, it's been slow going as far as what schools will require it, but those schools are listed there. With the GRE, the sections include analytical writing, with a score, possible score of 0 to 6, and then the verbal and quantitative reasoning, a range of scores from 130 to 170. And then the PA school interview. Again, some schools don't require an interview, but some do. So this will be helpful for those that do. So I've listed what you can do before the interview, during the interview, and after the interview. So before, be sure to research the PA program. Look at their mission, goals, their vision. Look at the curriculum and the rotations. Look at where their clinical affiliates are located. Know what a PA is and what a PA does. Compile a list of thoughtful questions to ask the interviewer. You don't want to go into the interview and not ask any questions. Asking questions lets the interviewer know that you've done some research on their program and the profession. Be mindful of any costs for the interview, travel expenses, parking. Confirm the day and time of the interview and what parking is available. Where is the building located? You know that some buildings on campus can be like a maze, so be sure you have an idea of where the room is and the person that you're going to meet with. It's okay to ask the person coordinating the interview what you can expect, such as a tour of the facility, what other folks you may be meeting as well. You know, some interviews are with only one person. Some may be with more than one person. The day of, dress business like, arrive 30 minutes early. It's okay to be a little bit nervous. If they're conducting the interview on Zoom, you must have your video on. Make that eye contact as best you can on Zoom. If you're in the room, if it's not on Zoom in person, make that eye contact. Be articulate. Be thoughtful. Your responses well thought out. It's okay to have a notepad. Ask the interviewer for their business card and when you can expect to hear from them on their decision. After the interview, be sure to send a thank you email. This can be done the following day. If a month has passed since the interview and you still haven't heard anything, it's okay to contact the program, the person that you met with, or another program representative, and ask what your status is regarding admission. You don't want to call too many times, though. So just one or two times to see what your status is. Some students get waitlisted, so that may be a decision as well on the part of the program. Now, this is advice directly from a PA program director. And you see the picture there of the fireman going up the tree. So if you're using PA school as a stepping stone to the MD, you're barking up the wrong tree. So that's a definite no-no. Will not be well received at all. Okay, so we've had an articulation agreement with Arcadia University PA program since late in 2018. If you don't know, Arcadia is the only PA program with a program in Delaware. In fact, it's in Newark. You'll see the term Christiana on their websites, but it's right across from Christiana Hospital. Their main campus is in Glenside, Pennsylvania. But we went into an articulation agreement with them for assured admission. Now, this assured admission route is open only to MDD pre-PA majors. What are the criteria? Have to have an overall GPA of at least 3.5 or higher, and prereqs 3.5 or higher. The courses are listed there as far as what classes go into that GPA that you take in your first 2 years. Students must complete a minimum of 12 credits per semester. So why was that put in there? Well, PA school is very fast-paced. I think if you talk to PAs, they'll tell you that. It's very fast-paced. So taking 12 credits per semester in the fall and the spring gives the admission committee an idea of what class load you can handle. Must have at least 200 direct patient contact hours. So what does that word direct mean? They want to see that you're performing some type of a medical test on patients in your role as an EMT, as a CNA, as a medical assistant. It could be as simple as vital signs, but that's what they're looking for in that term direct. Shadowing patients aren't going to satisfy that direct term there. They used to require the GRE, but the GRE is no longer required. Must have 3 letters of recommendation, but that's part of your CASPA application. You don't have to have that when I start asking for, the documentation of the other information. That will come when you go on CASPA and go through all those tasks that I've discussed. So the letter can be from an MD and or a PA, and then professors. You need to have a recommendation by the MMSC pre-PA committee, and along with myself, Dr. Sam Biswas and Dr. Kimberly Walker, also know all that information. Is certainly helpful to you going forward. And I want to say one more thing about CASPA. So I mentioned that the CASPA website will close for 2 weeks in the beginning of April, or mid-April, and then they'll open back up at the end of April. And I mean the very end of April. Many times it's April 30th or April 29th where the new cycle will begin. So you have an idea of the PA program's deadline for submitting the CASPA application. Many students take a gap year. What is a gap year? A gap year is just taking some time to accrue more patient contact hours to make your application a bit more competitive. Understand, I'll use the example of Arcadia, just because I'm most familiar with their program. They receive 3,000 applications per year. So doing whatever you can to separate yourself out from other applicants. You're already doing it by being in this major and taking all those medically related courses. So taking a gap year, you graduate, take a gap year, you would wait for the CASPA cycle to open back up at the end of April, and then you would just proceed to upload all your academic information, all your courses, have your transcripts sent electronically or by mail through the UD registrar, uploading all other required documentation, asking at least 3 people to write a letter of recommendation on your behalf, and then just submit your application. In contrast, if you're not taking a gap year, this is the scheme our students have followed. So junior year, wait till the CASPA cycle opens back up at the end of April, and then proceed to upload all your information, identify the people who can write a letter of recommendation for you, submit your application, get a call or email to go on an interview. That could happen this summer, going from junior to senior year. And then many students have gotten acceptance letters in the fall semester of your senior year. So that's the scheme timeline if you're not taking a gap year. So I wanted to make sure I got that in. And I also have a link down here, also on our website, the MDD Pre-PA website. On the lower right-hand side, I believe, are facts, frequently asked